So, good afternoon, everyone, and welcome to today's Facebook Live session on awareness regarding osteoporosis management and bone health. And today we are privileged to have with us one of a great doctor who can guide us for this. So, welcome, Mr. Dr. Sumit Mahajan. So, Dr. Sumit Mahajan is a highly experienced and qualified orthopedic surgeon. He provides you with world-class treatment for all bone and joint-related problems. He was the first doctor who has done various complex surgeries, like first doctor to do surgery regarding cartilage replacement in the Amritsar and many other robotic surgeries. He is also a well consulted doctor for sports injury. Many players have been treated by him, and he has done more than 10,000 plus surgeries till now successfully and made patient better in their life and also gave a smile on the patient's face. And he's a very well-known, reputed doctor who can guide us better about osteoporosis management and bone health and things regarding this silent disease. So, welcome and thank you, doctor, for giving us this time. So, over to you, doctor.
Thank you, Kadam, for having me. So the topic which we are going to discuss is osteoporosis, management and bone health. Hi, I am Dr. Sumit Mahajan. I am a senior consultant and head at Apollo Hospital, Amritsar. I also give my services at Chandigarh and Jammu. So the topic which we are going to discuss today, or I am going to tell you, is the osteoporosis. So I always tell my patients that osteoporosis is the silent killer. It is just like dimak in your bone. So how do we diagnose it? How do we treat it? And what are the latest advances in osteoporosis? These are all the things which we are going to tell you in the further slides. So osteoporosis means when you do the cross section of the bone, there are small holes in the bone. When this hole unite together, it makes the bone porous and it makes the bone fragile. So this is the osteoporosis. One out of every three females and one out of every 8 males in India suffer from osteoporosis. So there is low bone density, deterioration of bone tissue, disruption of bone microarchitecture, and compromise of the bone strength, and that leads to the fragility fracture. How do we define osteoporosis? There is a WHO classification of osteoporosis that is diagnosed with the BMD, that is bone mineral density. If it is negative 2.5 deviation, that means it is osteoporosis. It is 1 to minus 2.5, then it is osteopenia. That is, bone is not doing good. Then we need to intervene and do something to make the bone strong again. What are the global burdens of osteoporosis? The osteoporosis can lead to not only to the fractures, but also to the bent spine. You have seen a lot of females having a kyphotic deformity of the back. They cannot stand properly. These are all the things because of the osteoporosis. They have got a silent collapse of the vertebra, so that the whole of the length of the vertebra it gets subsides to the small wedging of the vertebra, and they have got a kyphotic deformity. Plus, it can lead to a lot of fragility fractures. So, as we have already told you that 1 in 3 women above the age of 50 years will have the osteoporotic fracture, and the man is also not away from this. 1 in every 5 men more than 50 years suffer from osteoporosis, especially those who are taking lot of smoke, who are doing lot of smoking and taking lot of alcohol. The osteoporosis is prevalent in that men. So, as I have already said, that it can lead to fracture. Say, for example, the patient is having a trochanteric fracture. It can lead to the global burden, not only to the healthcare system, but also to the family of the patient. Say, for example, somebody has a fracture because of the osteoporosis. They have a fracture of the trochanter. जो हिंदी में बोलते हैं चूला टूट जाता है, then they have to get the operation, and till the time the fracture heals, they have to be bedridden, and that can lead to bed sores, and sometimes can lead to death also, because the patient has got a difficulty in breathing, chest pain, and all that stuff. So you have to take care. And sometimes most of the people are having, wrist fractures also. They are having fractures of the spine. So these are all the things, which can lead to the burden. There is a global burden of osteoporosis. So not only in Asia Pacific, but also in the whole world, the people who are not taking enough of the protein, they are not taking a good diet. Even if they are taking a good diet, there is a degenerative changes in the body that can lead to, osteoporosis. So coming to India, 1.3 billion people are, we have got 1.3, 1.4 billion people. Approximately everyone in India above the age of 50 are suffering from osteoporosis, and especially those, and men are also not away, as I've already told that, those people who are smoking, those people who has got cancer, those people who are got, the age more than 70, 80, their bones are also brittle. So they have to take care of the osteoporosis to prevent the fragility fracture. So what are the risk factor that is associated with the osteoporosis? So there are two main risk factors. For example, the woman who have got the history of osteoporosis will have the osteoporosis, number one. Number second, white women, lean properly, especially in India, we do not take a lot of proteins. मैं अपने पेशेंट्स को बोलूंगा आलू खाओगे आलू ही बनोगे. So you have to take a lot of proteins. If the diet is not good, you are not doing exercises. Exercises is also very very important, because if you are not doing exercises, gym में बोलते हैं, you lose it, you use it or you lose it. If you do not use it, then you will lose it. Then that is also one of the important factor, that you should do exercises. Especially the weight training is very very important. Especially the weight training is not for 20-25. Weight training is for the people, especially women more than 40 years, perimenopausal women. They should do exercises, they should eat healthy, they should have a lot of proteins in their body. And at the same time, if there are visible signs, that means if your height, the spinal height, if say for example you are 5 feet 6 inches tall, and suddenly you feel the kyphotic deformity in your back, and your height has reduced, it is because of the fact that you are suffering from osteoporosis, or you are getting a with a minimal fall. Say for example, you just fall on the some people fall on the bathroom, and there is a fracture on the wrist. That is called as a fragility fracture. And some people just get slip in the bathroom and got a fracture of the neck of the femur. That is also the fragility fracture. So these are all the things that you should not look down upon. You should consult your orthopedic surgeon. You may be suffering from osteoporosis. And so age more than 60 years, gender, whether male or female, all can suffer from osteoporosis. I've already told the family history of osteoporosis, previous fracture, just with the minimum fall that you are having osteoporosis, especially for the females. If you got a menopause at between the age of 48 to 52, or sometimes there is a early menopause, or sometimes the iatrogenic or the doctor induced menopause is hysterectomy. When your hormones are not proper, you have got a imbalance in the hormones, then also it can cause osteoporosis. And sometimes you take the medicines in the form of say for example some cancer medicines, some radiotherapy, some chemotherapy can also lead to osteoporosis. So what we can do to prevent osteoporosis? So we will not only touch osteoporosis, but we also touch osteopenia. Say for example, a young healthy female with a normal cycle periods. This is the scenario. Young healthy female with normal cycle periods, the monthly periods, come to me with malaise, fatigability, and and pain all over the body. So what should me be thinking of that particular female? I should be thinking whether she has got a good vitamin D, number one. Number second, whether she is taking some calcium or some supplements. Number third, that is important, is whether she is doing some exercises or not. So, and the most important thing, whether she is also taking some, whether her hemoglobin is good or not, and her diet should contain high protein, whether she is taking a high protein diet or not. So I'll take a history of all this stuff. कि मैडम आप कुछ कैल्शियम ले रहे हो, आपका विटामिन डी कितना है, अगर नहीं कराया तो उसका विटामिन डी का टेस्ट कितना होना चाहिए, whether you are taking some, you have got a normal periods or not. If you do not have a normal periods, it can be a sign of early menopause. And then we have to take care of everything, whether you are doing some exercises and dietary supplements. So my treatment depends upon, particularly my treatment is divided into three parts. Number one, her medicines. So at 40 years or 35 years to 45 years, my treatment will contain vitamin D. So everyone should take vitamin D once a week. If you have got a test and your vitamin D is less than 30 nanogram per deciliter, you should take vitamin D every week for 2 months, 8 tablets, and then once a month for 10 months. So this is for everyone. So every week for 2 months, and then once a week, every week for 2 months, and then once a month for 10 months. So this is a yearly medicine, and then you have to repeat it again after next year. You should take, at least according to your age, 4 months of calcium. You can take alternate day, so you will take for 8 to 9 months and take a break for 1 or 2 months. And you should also take collagen at that time. Your diet, and this is the one medicine. So these are all the medicines. Number second, her physiotherapy. That is, she should do some exercises, 10 minutes of cycling, half an hour of walk, and some weight training. Is very, very important for the female between 35 to 45. And number third, they should, increase their protein content. At least 40 grams of protein is required for each and every one. So if you do not eat that quantity of protein, your bones are going to become brittle. Plus the other things like zinc, vitamin K27, plus vitamin B12 is also very, very important for treating the osteopenia or osteopenia. So this is the first treatment between the 35 to 45 years of age. After 45 years of age, now comes the perimenopausal phase. And sometimes if the patient has got an early hysterectomy, कि उनकी बच्चेदानी निकल गई हुई है, and that time we'll treat that patient as a menopause only or a perimenopausal patient only. In that time, we should add something like, if like the estradiol or digestrone, or sometimes we also add on this bisphosphonates in the form of alendronate, zoledronic acid, or the tablet form, whatever we can give. That is either once a week or once a month. There are different tablets that is available, plus vitamin D, plus calcium, plus collagen. And your calcium should contains everything. It should contain calcium also, calcitriol also, zinc also, B6 also, K27 also, and B12 also. So that there is a holistic treatment of having a calcium. So in India, there are a lot of companies that are available that makes such kind of calcium. So you take it alternate day, calcium and collagen. You should take vitamin D once a week for 2 months, and then once a month for 10 months. And you start with your bisphosphonates. The problem with bisphosphonates is that you cannot take it for a very long period of time. Say for example, if you are taking it for 3 to 4 years, then you are making the bone very strong. The strong bones can also lead to fracture. So you have to avoid that thing. So in my practice, what I say is, say for example, 45 to 50 years of age, we give at least 5 months a year, and then take 5 months a year, once a month, and then give a break for at least 7 months. And then if she is 60 years of age, 6 months a year, 70 years of age, 7 months a year, and my patients are doing very good in that scenario. Number third is, sometimes, the patient with 60, 65 years of age, or sometimes 70 years of age. So whenever there is pain in the back, then you have to add something that is called as the calcitonin nasal spray. There are injections also for this, but this spray is better because you can, do it at home. So these sprays helps in the deposition of calcium inside the bone. So you go from the nose, then you go directly to the pituitary. From the nose, you go to the pituitary. You release a hormone that is called as calcitonin hormone, and you tell that calcium, order that calcium to go inside the bone. So so the bisphosphonates prevents the calcium from coming out of the bone, and it allows the calcium to go inside the bone. So this will help preventing the bone to become more porous, and the calcium will deposit inside. And then sometimes the people are not, and we ask the patient to get the DEXA scan after a year or so, and sometimes the people are the females or male, or the person with the metabolic disorder are not happy with this. The DEXA scan has not improved. They are not feeling comfort with such kind of medicines, and sometimes the people cannot eat such kind of medicines for a very long period of time. So in that scenario, what we do is we can give teriparatide to the patient. In the severe osteoporosis, say for example, sometimes the osteoporosis is -4 standard deviation, or sometimes it is -3.5 standard deviation. Then we give the teriparatide or a denosumab in such kind of severe osteoporosis. So this is also very important. So what is the doses of teriparatide? The teriparatide we give every 0.5 ml every day for at least 3 months. And this teriparatide is also very important in the bone healing also. Say for example, somebody with an osteoporotic fracture, we put a nail, and then we'll put the patient on teriparatide for at least 3 months, and that we have seen that in that scenario the fracture heals properly. Of course the surgery has to be done properly, but it also helps the fracture to heal faster. And same is true with the denosumab also. The beauty of denosumab is that you will not get a fractures in such kind of scenario when the bone become very hard. So you can safely give it for 5 years, 6 years, 7 years also, and the dose is 6 monthly. So say for example, bi-yearly you give, 6 monthly you give, and the compliance is also better because the patient will feel that रोज तो मेरे को इंजेक्शन नहीं लगाना पड़ रहा, तो मेरे को 6 months में एक बार ही इंजेक्शन लगाना है, तो then they are very happy with that. And rankle inhibitors, they work according to the rankle inhibitors. So so these are all the things which we have already discussed. And the latest is the and in the severe osteoporosis, of course, I have told you about the denosumab, which is a monoclonal antibodies approved recently in India, and specifically target the ankle, and especially for the postmenopausal osteoporosis with the high risk of fracture. So in the severe osteoporosis only, that we give the denosumab. So these are all the things which we have already covered. So same, it is a repetition of what we have already spoken. So lifestyle, calcium, vitamin D, and exercises. This is number one. Number second, first line of treatment is bisphosphonates. If the patient is also having a pain in the back, and there are got osteoporotic fractures of the back, then you can add the calcitonin nasal spray. Number second is the teriparatide and denosumab on the same level. Denosumab will give 6 monthly, and teriparatide we have to give daily through the subcuticular dose. So all these things have been covered. So the forum is open for question. I love to answer each of them.
Yep.
Thank you so much.
Thank you so much, Dr. Sumit Mahajan. You really explained each and every treatment outcomes possible for an osteoporotic patient in a very nice and very simple yet very understandable way. So we have a couple of questions. So I will ask you. So first is like which patients should be proactively screened, like they have to be very particular in the follow-ups, or before diagnosis they have to be going different tests. So what kind of patient should be screened on the daily basis?
So so this is a very good question. uh, who can be screening, especially females, early menopause. That is the second important patients which we can see. The patient who are getting a hysterectomy, say for example, you have seen many patients getting a hysterectomy at the age of 38, 40, 35. So these are the patients who are prone to have a osteoporosis. And you have seen that patients suffering from knee arthritis also at the same time. Since I do a lot of knee replacement, so knee arthritis at the same time. क्योंकि उनको हमेशा ये बोला गया है कि सर हमको तो बताया ही नहीं गया कि हमारी हड्डियां कमजोर हो जाएंगी हिस्टेक्टमी के बाद. So these are the patients, and particularly the patients who are undergoing a cancer treatment. Say for example, किसी को किडनी का कैंसर हो गया, उसमें ऑलरेडी बोन्स कमजोर होती हैं. So the treatment which we are giving is also making the bone brittle. So osteoporosis उसमें भी बहुत ज्यादा होगा, and then at that time then you have to screen that patients, getting a BMD, bone mineral density, and also the amount of vitamin D they are having. Of course, the calcium will remain same in all the patients. Sometimes the patient come to me in my clinic, डॉक्टर साहब कैल्शियम तो ठीक है बिल्कुल, आप पता नहीं क्यों मेरे को कैल्शियम दी जा रहे हो. सो कैल्शियम ठीक रहेगा बॉडी के अंदर, बट वो कैल्शियम चूसेगा कहाँ से? हड्डी से, to remain that optimal, because the amount of calcium is very very important. Optimal range is 8 to 9, 8.5 to 9. अगर उतना लेवल नहीं रहेगा तो आपका बॉडी फंक्शन नहीं करेगा. How will we get the calcium? We'll get the calcium from the bone. So you should have so these are all the things. I'll just repeat. The early menopause patient, all the patient above 40 years of age, especially females, the hysterectomy patients, the patients who are chronic smokers, and the patients who are on cancer treatment, they should be screened properly.
Okay.
I've asked. Well,
Yeah. So the next question is like, what are the other factors? Like we know that fracture can impact on bones and it can cause to osteoporosis, lack of calcium and everything. What are the other factors, external factors that can impact or on the disease activity, or can also increase the frequency of osteoporotic pain or anything?
so I've already told you that, say for example, you have got a sometimes firstly is the diagnosis. We have already told you then how to diagnose this. Number one step is that we have already answered that thing. Now this is the continuation of the same tip. Some medicines can increase it. Yes, the cancer medicines can cause osteoporosis. The seizures medicines can cause osteoporosis. The chronic smoker can cause osteoporosis. The perimenopausal persons can cause osteoporosis, and some patients who are on hormonal treatment can also cause osteoporosis. So these are the factors which can increase the risk of osteoporosis. And how will we diagnose it? The diagnosis is simple for all the osteoporosis. Get a BMD and your vitamin D levels.
Okay. So, are there any signs of osteoporotic patient who tend to take any treatment, for example, teriparatide or denosumab, and they in between they stop the treatment or and they don't go. So, how you consult those patients and what is the advice you can give to those patients?
So, this is very important question. So the compliance is very, very important. At least in my scenario, since you know that teriparatide and denosumab is a costly procedure, and in India, everyone is not have such kind of pockets to purchase that particular thing. And my practice, I give bisphosphonates to each and everyone. The patients who are having osteoporosis, but we cannot give bisphosphonates for a very long period of time. You can, because that will make the bone initially stronger and then brittle. So we'll give it for some times to make the bone spongy. Say for example, if we are giving a bisphosphonate, we'll give it according to the age: 50 years 5 months, 60 years 6 months, 70 years 7 months, and all that stuff. But if you have started with teriparatide, well, I make it sure that I ask the patient, I counsel the patient that you have to take it for 3 months. Especially my theraparatites are given to those patients either with the osteoporotic fractures of the spine, जो vertebra आपका बिल्कुल. Number second is the osteoporotic fracture of the hip and wrist. In that scenario, we'll give osteoporosis. And then those patients who are having a fracture, they do not, miss that dose. But in the normal scenario, which I've seen, that it's some patient are coming with the osteoporosis and 60, 70 years of age, and ask them to, get a 3 months of injection, they will not. They will not. So in particular patients, those who are having a fracture, and those who are suffering from some kind of disease, they are very compliant with that thing, but we counsel the patient that you have to take it. Coming to denosumab, so this is a game changer. So but though it is very costly, so it should be the price should be reduced furthermore, though the companies are giving the patients in a very low rate, but though the MRP is very very high, so that is very compliant because 6 monthly you have to take single injection. तो वो बोलते हैं कि कोई बात नहीं डॉक्टर साहब 6 महीने के बाद अगर एक बार लगाना भी पड़ा तो कोई दिक्कत नहीं है. And I've seen my patients for the I've been practicing for the last 20 years, so for the last 5 to 6 years I'm giving it. You can give it safely for 5 years, 6 years, 10 years, and you have seen a dramatic improvement in your BMD also. So this is a thing, but patient has to be the coming to your question is the patient has to be compliant with the whatever dose they are taking and whatever the doctor has prescribed them.
Okay. So next question is something related to the caregivers of the patients. So how can they
Pardon?
play a role in make. So next question is how can a caregiver of the patient, any family member or any relatives, how they can play a role in making the treatment successful for a patient?
They should be compliant. I've already told in a detailed way that they should be compliant. They should ask the भाई आपको माताजी लेना ही पड़ेगा, अगर आप नहीं लोगे तो आपकी हड्डी और फ्रैक्चर हो जाएगी, then you will be bedridden.
Okay.
In some way or the other, I also tell my patient, sorry, it is out of the way. तो अगर सपोज करो आपको एक सर्जरी का 1 से 1.5 लाख रुपया लग रहा है, and then you are giving 7-8 thousand का इंजेक्शन, so you are ultimately saving the money, you are preventing your fracture. So in that way you have to counsel the patient, भाई ले लो, नहीं तो बाद में आपकी को प्रॉब्लम होगी, आपको भी प्रॉब्लम होगी, साथ में आपके परिवार वालों को भी प्रॉब्लम होगी. और परिवार वालों को इस तरह से समझाते हैं कि अगर माताजी बेड पे होगी तो फिर आपको भी प्रॉब्लम होगी, तो देन they understand.
Okay. So one last question is like what are the other simple lifestyle modifications that can a patient do in their daily lives to get a better result after going to these treatments?
So this is a very very important question, and this is for everyone. Those who young people who are listening to me, it is for everyone. So I've already told you. So the first thing is your diet. आप carbs और fats को अपनी diet में कम करो. So this is very important. I'm speaking in Hindi so that my listeners should understand. Some people who are not very well versed English can also understand. So अपने fat और carbohydrates को कम करो. Take high protein diet. In Indian diet, जो हिंदुस्तान की डाइट है, उसमें जो भी आप फैट लोगे, आप प्रोटीन लोगे, उसमें आपको फैट भी मिलेगा. और हाई प्रोटीन डाइट में क्या क्या आता है, से फॉर एग्जांपल वेजिटेरियन डाइट. द वेजिटेरियन डाइट एंड इन अ पेरीमेनोपॉजल फेज सबसे ज्यादा इंपॉर्टेंट चीज है वो सोयाबीन. तो सोयाबीन इज नॉट ओनली सिंपल सोयाबीन हाई सोर्स ऑफ प्रोटीन, बट इट ऑल्सो कंटेन फाइटोइस्ट्रोजन ऑल्सो. So soybean is it is a boon for a perimenopausal phase woman. So 48 से 50 years या 40 का साल के बाद ही फीमेल्स को सोयाबीन खाना चाहिए. That contains high protein and high estrogen content, phytoestrogen content. फिर आपको आर्टिफिशियल फॉर्म में नहीं लेना पड़ेगा. You should change your आटा. So जो आप आटे की रोटी, जो हिंदुस्तान में रोटी सब खाते हैं, आप अपने आटे को चेंज करो. आटे को क्या चेंज करोगे, उसके अंदर डालो बेसन, ग्राम फ्लोर या सत्तू जो रोस्टेड चना होता है, उसको आप उसको ग्राइंड करके डालो उसके अंदर डालो रागी, यू विल हैव अ गुड आयरन कंटेंट एंड अ गुड प्रोटीन कंटेंट। आप उसके अंदर सोयाबीन डालो, देन अगेन अ हाई सोर्स ऑफ प्रोटीन, ज्वार बाजरा डालो, और थोड़ा सा गेहूं डालो जिसको ग्लूटेन, मेक इट अ ग्लूटेन फ्री आटा। सो आप उसको उसकी रोटी खाया करो, एंड यू विल नॉट हैव अ गिल्ट दैट क्या आज मैंने रोटी खाई है। सो यू विल टेक लॉट ऑफ 40 ग्राम्स ऑफ प्रोटीन आपको रोटी खाने से ही मिल जाएगा। नंबर थर्ड, आप अगर दूध मिल्क मिल्क प्रोडक्ट्स पीते हो 40-45 के बाद, मैं उनको बोलता हूँ स्किम मिल्क किया करो, 2 बार उबाल के पी लो, 2 बार मलाई निकाल लो उसके अंदर से, तो आपको ये जो दूध मिलेगा, यू शुड हैव दैट मिल्क। कुछ देसी इलाज इज वेरी गुड, जो हम बोलते हैं हमारे आयुर्वेद वगैरह में लिखा हुआ है, दैट मीन्स। और आजकल हम फार्मा कंपनी वाले भी लॉट ऑफ कर्क्यूमिन बना रहे हैं, कर्क्यूमिनाइड्स आए जा रहे हैं, पिपरिन आ रहे हैं। सो कर्क्यूमिनाइड्स एंड पिपरिन, व्हाट इज दिस? दिस इज जस्ट हल्दी एंड काली मिर्च। You should take that protein, that milk contains protein. The curcumin contains an anti-inflammatory, and the piperin will activate it. You should take that kind of milk in your body. So प्रोटीन कंटेंट को बढ़ाना है, जब हम जो भी प्रोटीन कंटेंट बनाएंगे उसके साथ कार्ब्स और फैट्स हमको मिलेंगे। इफ यू आर टेकिंग अ नॉन वेजिटेरियन डाइट, एग्स आर द वेरी गुड सोर्स ऑफ प्रोटीन, very very good source of protein is egg। again uska yellow ka yolk contains lot of good fat also, but if you have increased cholesterol level, you should take at least one yolk, not more than that। अंडे आप 3-4 खा लो, but take a albumin part, not a yolk part, more than one or two। then chicken is very good। red meat you should avoid, because if you are having a cholesterol problem, you will, your cholesterol will further increase। but if you are kabhi kabar aap kha rahe ho, so you can take that red meat also। fish is a very very good source of omega 3 fatty acid and protein, and fish is also a very good source of protein, तो वो आप जरूर लो अपनी डाइट में if you are a non vegetarian। और ऐसा नहीं है कि सिर्फ नॉन वेजिटेरियन को ही प्रोटीन मिलेगा, वेजिटेरियन को नहीं मिलेगा। स्प्राउट्स आर वेरी गुड सोर्स ऑफ प्रोटीन्स। सोयाबीन इज वेरी गुड सोर्स ऑफ प्रोटीन। आई हैव ऑलरेडी टोल्ड यू अबाउट आटा। So this is the dietary habits that you have to teach, number one। number second is your exercises। I have already used this proverb, you use it or you lose it। अगर आप अपने शरीर को यूज नहीं करोगे, यू विल लूज दैट मसल मास। फिर आपको बुढ़ापे में कोई भी चीज उठानी है, आपसे उठाई नहीं जाएगी, आपकी हड्डियां और कमजोर होगी। दोज हु डू एक्सरसाइजेस, स्पेशली वेट ट्रेनिंग, इज अपनी उनका बुढ़ापा बहुत अच्छा निकलता है, बिकॉज उनके मसल्स बड़े स्ट्रांग होते हैं। लेकिन दैट डजंट मीन डॉक्टर साहब मैं तो 1-1 घंटा वॉक करता हूँ। वॉक करना अच्छी बात होती है, कार्डियो करना इज वेरी गुड फॉर हार्ट, बट कार्डियो करना फॉर अ वेरी लॉन्ग पीरियड ऑफ टाइम, वो सिर्फ आपका फैट कम नहीं करता, मसल मास भी कम करता है। इफ यू आर डूइंग अ कार्डियो, तो WHO गाइडलाइन इज यू डू अ कार्डियो फॉर 30 to 45 minutes, and but 15 to 20 minutes you should do a weight training also। So this will also prevent your osteoporosis, especially those who are between 35 to 45। in 40s you have to prepare yourself for 50s, in 50s you have to prepare yourself for 60s। सो आपको एक्सरसाइज करनी ही पड़ेगी, मस्कुलर स्केलेटल आपको इंक्रीमेंट करना ही पड़ेगा, एक्सरसाइज करनी ही पड़ेगी, वेट आपको कम करना ही पड़ेगा, आपको टॉर्सो, आपका जो टॉर्सो है उसको, उसमें फैट को कम करना पड़ेगा, सो दैट आपको बैक और आपके अब्डोमिनल मसल्स ठीक रहे और आपको बाद में फ्रैक्चर ना हो। So this is the second thing that you can do। And number third is that your vitamin D should be proper। I've seen lot of patients, छोटे बच्चों से लेकर 1-2 साल के बच्चों से लेकर, उनको अगर विटामिन डी की कमी होती है, उनकी टांगे टेढ़ी हो जाती हैं, उनको पेल्विक फ्रैक्चर हो जाता है, कुछ और चीज हो जाती है, उनकी हड्डियां फ्रैक्चर हो जाती हैं, एल्बो फ्रैक्चर हो जाता है। बड़ों को 20 से लेकर 35 तक उनको मलेस रहता है, डिप्रेशन हो जाता है। and vitamin D के receptors, that there is a presently a study that vitamin D का receptor is in everything। डिप्रेशन इज ऑल्सो रिलेटेड टू विटामिन डी। अभी कोविड में कितना विटामिन डी खाया लोगों ने, चेस्ट की प्रॉब्लम भी विटामिन डी के साथ, गट की प्रॉब्लम भी विटामिन डी के साथ। सो यू शुड हैव ए ऑप्टिमल लेवल ऑफ विटामिन डी, 30 नैनोग्राम पर डेसीलीटर से ऊपर विटामिन डी होना चाहिए। सो दीज आर 3 थिंग्स दैट यू शुड always do। and once you have diagnosed with osteoporosis with the BMT, please take these medicines। these medicines are very very important। then you do everything, you eat everything, you do a lot of exercises, everything you can do, but ये दवाई खाना तब बहुत जरूरी हो जाता है once you are diagnosed with osteoporosis।
Okay, thank you so much, Dr. Sumit Mahajan, for giving such a nicely answers to the questions and giving a proper guideline to the patient how to treat this osteoporotic silent disease. So, if you want to summarize the whole session, whole talk in 3 points, how what will be that summary?
So eat healthy, have a good, do good exercise. Weight training is very important. Number third, good vitamin D levels. And number fourth, if I add, if you are suffering from osteoporosis, please get a treatment from the orthopedic surgeon.
Yes, definitely. If that is the most important point, that early diagnosis and meeting your doctors is the first foremost thing to do when you have such a silent disease. Yeah. So thank you so much, doctor, for taking your time and giving us such a good knowledge about this silent disease and giving us how to manage it. So if possible, we can also conduct some other session on the similar topic, on any other topic, whenever you get some time
Of course,
after
we can. Of
few
course, we
days.
can. And thank you for having me. It is
Yes,
lovely,
yes.
be associated with you people. Thank you so much.
Yes. Thank you so much, doctor. And thank you for the viewers for watching us.
Thank
Till
you
the
so much.
next time, thank you. Stay safe, stay healthy. Until next time. Yeah.